Number one are all the bad things, GMOs, the chemicals in the environment, and then the other thing is you're looking at not enough nutrients, particularly mineral nutrients. And these two forces together have caught Americans in the crossfire, if you will, and that's why we're the #1 obese nation in the world. It has nothing to do with not enough exercise, has nothing to do with too much food. And again, it's the chemicals on one hand taking us out of the reality of nutrition and the lack of nutrition, mineral nutrition in particular. Now, if I may say one thing, we have so many examples, literally thousands and thousands of examples of people who tried everything to lose weight, including surgery and so forth. And what's happened is we've been able to help people lose 400 pounds, 200 pounds, 100 pounds, as you have with your staff member. And it's simply by giving them mineral supplements. It doesn't matter if they take our Rebound in the 90 essential nutrients, or if they take Pollen Burst in our nutrients. It doesn't matter if they take the ASAP in our nutrients. As long as they're taking the minerals, they will lose weight. And of course, it doesn't take long. You're on 2 meals a day. You're just not really hungry, and you have to watch it. You have to be able to eat to make sure you're getting all the nutrients you need to be healthy. And so if you supplement properly, that will happen. Just last month, in April, the Food Chemistry Journal, a very well-respected journal supported by the USDA, came out and said that the kids' foods that we have respected over the years, things like Gerber's and Similac and Enfamil and these types of things that we trusted, have less than 20% of the nutrients, vitamins, and minerals that kids need. Less than 20%. It was big headlines. Food Chemistry Journal in April, just last month. 20%. We feed our dogs and our rats better than we feed our kids. And this is why we have diabetes. This is why we have autism and ADD. Then you throw into the mix all the chemicals in the environment. We have a mess here because the kids aren't even getting as much nutrition as a dog. And that is a crime. It's not a shame. It's not terrible. It is absolute AAA felony. And all the pediatricians who know this should be put in jail, absolutely put in jail. Even organic foods, Alex, that just means that there's no chemicals on them, which is very good because it reduces the chemical load, reduces your risk of cancer, but doesn't give you any nutrition. No guarantee of nutrition. Plants only need 3 minerals to be healthy and make good seeds for the next generation. We need 60. And so you can eat a pretty good slice of organically grown multigrain bread baked by the pastor's wife on Sunday in the church, and you're 57 mineral short unless you supplement. And that's what we learned in the livestock industry because we don't have insurance. Medical doctors have learned how to game the system using insurance. They feel that if they charge you $3,000 for a procedure that really only costs $50,000, that they're not hurting the patient because insurance pays. And they've financially broken America with this overcosting of health care. And this is one of the reasons why I went after the FDA. They used to say things like, you can get the omega-3s you need by eating foods rich in omega-3s and reduce your risk of stroke and coronary thrombosis and pulmonary embolism and deep vein thrombosis. You could not say, until I sued them, that you can supplement with omega-3 essential fatty acids and reduce thrombotic stroke, coronary thrombosis, pulmonary embolism, and deep vein thrombosis by supplementation. That was against the law to say that. They would shut you down and put you in jail. So I went to court, sued them in federal court, and actually won. And the one that I love is, and you'll really appreciate this, was on antioxidants. Antioxidants being able to reduce your risk of inflammation in your arteries and plugging your arteries, reduce your risk of cancer. And I prevailed in federal court on that, and they appealed. And I prevailed again in the appellate court, and they appealed again. And they signed off on the steps of the U.S. Supreme Court, and I felt, gosh, that felt too easy. There's something up. And sure enough, 6 months later, they had a sister agency in the Department of Health and Human Services sue them, not both of us, but sue them to unravel the agreement. And I had to go to the federal judge and ask to be a co-defendant with the FDA. And he said, well, you've been suing them into the ground for 10 years. Why suddenly do you want to be a co-defendant with the FDA? And I said, well, with all due respects, Your Honor, I don't believe that they will defend the agreement vigorously, and I have to be there to do that. So he made me a co-defendant with the FDA, and they immediately dropped the lawsuit because they knew we'd prevail again, and they didn't want the precedent in the Supreme Court. right. Well, first of all, we've known for 60 years, Alex, that type 2 diabetes is a simple mineral deficiency. We learned this in the animal industry, and it was actually, the research was done by one of the heads of the departments of the U.S. Department of Agriculture, a guy by the name of Mertz, Walter Mertz. And he discovered unimpeachably that type 2 diabetes is a simple mineral deficiency disease. You throw in the trans fatty acids, which he spoke about earlier, and I was so happy to hear you say that. The trans fatty acids, heterocyclic amines, terrible chemicals caused by improper processing of food and overcooking of food. And this injures the cell walls and makes them unresponsive to insulin. Well, there's a great series of billboards on the highways in Cook County around Chicago. It says, hot dogs cause butt cancer. And this is because of the trans fatty acids in there, plus the nitrates and nitrites. And this message was for kids, as you point out. The kids' cancer is just going crazy. Colon cancer, for instance, used to be an adult disease. Now you're finding colon cancer in young adults in their 20s because they've been eating processed meats with nitrates and nitrites in them for breakfast, lunch, and dinner. And either from fast food places, these things are cooked at home. We're talking about things like deli slices, sandwich meats, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, Spam, all these things that they put even on pizza. These meats with nitrates and nitrites in them increase the risk of colon cancer, as you point out, thousands of %. Just by burning your meat. If you cook your meat well done, which the medical system tells you to do, it increases the risk of breast cancer by 462%, according to the University of South Carolina. And so if you just give up processed meats with nitrates and nitrites, eat your meat cooked medium or medium rare, you supplement with the 90 essential nutrients and get your antioxidant points, ORAC points, above 50,000 for kids and above 100,000 a day for adults. Pharmaceuticals are, I don't know, they probably kill 100 times more people each day than street drugs. And it should be a war on drugs in hospitals and doctors' offices, not a war on drugs in the street. There's no doubt the research shows very clearly that chemicals in our diet and GMOs and all these various things you mentioned do have a terrible impact upon the human physiology. Well, this is extremely well known in the human health industry. It's certainly known at the high government levels. And these people, what should I say, they're certainly in it for themselves. And I think it's a form of enslavement. It's very seductive, and even a Senate committee came out and said that the medical system has learned how to game the insurance system. They'll bill for 8 different agencies for one procedure they did. You and I would go to jail for insurance fraud if we did that. The doctors get a walk because they spend more money on PAC committees than any other group of individuals. And so the elected officials love the medical system because of the money that flows to the PAC committees from the medical system and the pharmaceutical industry. And so this is why I've spent 35 years of my life, and you're spending most of your professional life getting information out to the public, because the strength of America is the basic citizen. It's always been the citizen soldier, the citizen politician, if you will, the citizen out there in the corner preaching the truth. And when it comes to health, we're going to have to take control here. We cannot depend on the medical system. We cannot depend on the government. Certainly can't depend on the people in it because they just do whatever the doctors say. So we have to teach our kids to begin to do these things at a very young age. When somebody has cancer or they have diabetes when they're 70 years old, in their minds they have to depend on the government and they have to depend on the doctor. Well, if we eliminate diabetes and we eliminate heart disease and we eliminate cancer and we eliminate Alzheimer's disease, which we can do, you'll find that we don't need the doctors and we can be citizen soldiers again. It's a form of slavery, and in fact, in the back of one of my books, I said that it's called Black Gene Lies, where all the diseases of black people are thought to be genetic, or at least promoted to be genetic by the medical community. And of course, I said, no, these are simple nutritional deficiencies. It was actually, the publication of that book was subsidized by a pastor in Atlanta, Georgia, Creflo Dollar, paid for that book to be published, called Black Gene Lies. And this is beginning to go through the black community, and they're reversing within days and weeks and months all these diseases that are thought to be genetic in the black community. And you're going to see an uprising here. And in that book, on the back cover, I said the black community has exchanged the chains of slavery to slavery from people in white coats and stethoscopes because of this genetic belief. And they have enslaved us because they have diseases that are simple nutritional deficiencies they say are genetic, one of which I was actually fired from Emory University in Atlanta back in 1978. I discovered the first non-human case of cystic fibrosis, learned how to reproduce it, learned the cause, prevention, and cure of cystic fibrosis in 1978, and they fired me because they thought I was sniffing glue. Well, I actually received an international award in 2011 for that work 35 years ago. And we now, and you know, Jerry Lewis was not on the telethon this last year, and the reason was we gave him the data. We've been working on muscular dystrophy. We believe we have found the cause, prevention, and cure of muscular dystrophy. We gave it to Jerry. We thought since they're Jerry's kids, he should be the one to make the announcement. And the Muscular Dystrophy Foundation fired Jerry Lewis because he brought him our data. That Alzheimer's disease and the other dementias are physician-caused diseases, Alex. The brain is 75% this white matter of the brain. And when the white matter of the brain, the myelin goes away and the nerve tangles, the nerve fibers tangle up. This is what causes Alzheimer's disease. Well, this white matter of the brain that makes up 75% of your brain weight, the insulation material is 100% cholesterol. So when people go on a cholesterol-restricted diet, they take cholesterol-lowering drugs like statin drugs, it actually is the cause, basic cause of Alzheimer's. Well, gluten makes your intestines look like you've been eating poison ivy for salads. It's a contact enteritis. It's not an allergy to wheat, although medical doctors and their little pea brains make that mistake. They think it's an allergy, and they will test you for it, and you're negative. It's not an allergy. It's like if you roll around in poison ivy, you're going to get a contact dermatitis, even though you're not allergic to poison ivy. If you eat gluten and you have a gluten intolerance, your intestines look like you've been eating poison ivy for a salad. And Mayo Clinic in 2009 came out and said, right there in Minneapolis, Rochester, Minnesota, that 30% of Americans now have gluten intolerance. And in enlightened communities around universities, it's 80 out of 100.